A majority of Utahns support the legalization of medical marijuana, according to one poll. We break down the complicated issue and chat with the state senator who is sponsoring a legislation to legalize it.
Time now for Inside Utah Politics.
Good Sunday morning, and thanks for joining us for Inside Utah Politics. I'm Glenn Mills. It was one of the most controversial and talked about issues during the last legislative session, and a bill to legalize medical marijuana is coming back. Senator Mark Madson's bill would legalize medical marijuana for people suffering from certain chronic conditions. Earlier this year, it fell one vote short in the Senate on the third reading. This time around, Madson got the conversation started a lot earlier, and he's feeling confident going into the session. We caught up with him at the Capitol to find out more about his bill and how it differs from the last one. Senator Mark Madson, great to have you on Inside Utah Politics. Thanks for being here with us.
Thank you. Great to be here.
I know this is a very complex and complicated bill, but simply put, what would it accomplish?
Well, what we've done is looked at 23 other states that have allowed individuals with certain conditions to use medical cannabis as an alternative therapy or as a complementary therapy for their conditions. There's 9 conditions that we've, again, borrowed from other states where the science is very strong that medical cannabis can improve quality of life, and created a process where within the state it can be grown, processed, tested, and dispensed. Patients can, with their physicians, fill out an application, submit it to the state, and get a card which allows them to purchase the medical cannabis that their physician recommends. That's it in a nutshell. You're right, it's very complex, and there's a lot more.
So they work, bottom line, they work with their physician. And you mentioned 9, obviously we can't go through all of those, but what are a couple of those conditions?
Well, again, what we've done is we've borrowed from other states and looked at the same science, looked at the same studies, and the most common conditions that you'll find are cancer. Those undergoing especially chemotherapy have complications that are helped with cannabis. Crohn's disease, other gastrointestinal conditions that are very similar to Crohn's. Epilepsy, we have a very limited population already benefiting in Utah. Epileptic kids, a lot of great science there. MS, multiple sclerosis. Cachexia, which is a wasting disease. Chronic pain, PTSD. I said 9, and it might have been 8. We've pulled glaucoma. After further consideration, there is an alternative to cannabis that decreases the pressure in the eye. Interestingly, that's the only thing that federally there is an approval for glaucoma, but there's something better. So I think that's pretty much most of the conditions.
Okay, we got through all of those. Last year, your bill fell short. What are you doing differently this year, and what's your outlook? Do you believe you can get it through this year?
Yeah, what we did is we went through all of the testimony in committee and all the floor, and the transcripts, and looked at all of the things that were brought up in opposition. And then went through them one by one. Many of them were just based on misunderstanding, either misunderstanding of the issue generally or my bill in specific. That's just an education problem, which is a challenge because you're fighting 70 years of propaganda in some instances. That's education. We found some, frankly, legitimate concerns. And so what we did, case by case, we went through and tried to address each one of those in a way that, again, allows the patients to get the medicine. This is a patient-first piece of legislation. We started with those, the citizens of the state who are suffering and could have benefit, and worked out from there. It was not made by, of, and for government. My bill was made with patients first.
You mentioned there were a few legitimate concerns. What were some of those that you believe you have addressed?
Well, we've set up a much more detailed process for licensing and inspection of the facilities. And we've been fortunate as we've been doing research. We have found that, again, the other 23 states have been doing this, some as long as 2 decades. There are best practices in the industry. We don't have to reinvent the wheel. So we have, again, borrowed from others' experience and others' expertise and folded a lot of that in. Now, some of that is a response to some of the criticism. Some of that is just because we had the time to go out and try and make it better and make a more viable bill and a better product for the patients. And so there are changes throughout along those lines. The essence of the bill, though, is we serve these people, patients first. We allow them to get access through a very tightly controlled and very regulated process.
Very emotional issue. Can you get it passed through the legislature this year?
Obviously, I wouldn't be doing this if I didn't think I could get it passed. We did come close last year. We've been working over the interim. I've been visiting with my colleagues, so I'm very optimistic we'll be able to build on the momentum that we started last session and beyond what we've done within the legislature. The people in the state have really tuned in on this, and the poll numbers were very favorable last year, as you know, looking at 75% support out of some of the polls. So the people, I think, are much more aware, much more informed and supportive, and so I think the people are going to have something to say about this. Either this during this legislative session, or as we've seen in other states, if people get too frustrated, they just go to referendum.
You bring up an interesting point I want to bring up as well. Last year, some of the people that voted against it thought, you know, it was just thrown on us at the last second. We didn't have enough time to really go into it. You did it opposite this year. I mean, you started as early as you could, as you mentioned, through the interim process.
Well, last year was frustrating. We had some drafting delays and some things that were, I guess, out of our control that kind of set it back, and that was used against it throughout, fair enough. But yeah, we had an opportunity. I think I opened the bill file the very first day we could open a bill file, and we've been working on improving it ever since.
A couple of issues from the opposition that you haven't brought up I would like to bring up and
Sure.
let you respond to. One, opposition will tell you that this will increase marijuana use among the youth. Two, they'll tell you it's the gateway to legalizing recreational use. How do you respond to that?
Well, first, there's zero evidence that it changes the youth use rates. I mean, I'm perfectly willing to concede that right now, any youth can get marijuana on their high school campus very easily. And my bill doesn't really pretend to change that at all. That the illegal market is going to still be out there. Teens and others who want to get it through the illegal market are still going to be able to do that just as easily as they can now. The purpose of my bill is to make sure that people who have these certain few conditions are not criminals and are not risking the loss of their homes, their children, their livelihoods because they're treating their conditions with cannabis. It really isn't going to impact those people who already decide they're going to break the law, be they teen or adult. There are many studies that prove that assertion is absolutely bogus. There are many studies that show, and articles written about the studies, that reinforce the fact that the teen use rates stay constant. If a state has a high use rate before they go medicinal, it'll stay high. If they have a low rate before, it's low. Utah is one of the lowest. If we went this direction, I don't think that Utah is any different in any material way than these other 23 states, and I do not believe there's any evidence to suggest that teen use rates would increase here in Utah if we did what 23 other states have done when they've seen no teen use increase. Pay attention, I would say to those people, pay attention to the legitimate studies and the legitimate data out there, and you won't be confused and falsely worried about that issue.
Talk about the people you've met and spoke with who are users of medical cannabis. You are one yourself, but we've also seen other people come out that may surprise you, people you know from church or from your school organization. Talk about the people.
Sure, and again, a lot of the different approach to this issue comes from how different legislators perceive the constituents, I believe. I mean, I really have a lot of confidence. I believe that my constituents are smart enough to make decisions about their own lives and their own medical treatment. I do not believe that all of my constituents are somehow on the take, somehow trying to run a scam and cop a high or do something nefarious. I just don't start with this presumption that that's what my constituents are doing. That's how the people of Utah are. So based on that idea of the people in the state, we have built a bill. The people that are poised to benefit from this are from all walks of life, from all ages, but they happen to be stricken by either cancer or MS, epilepsy, or some of these other conditions. But again, I would challenge the attempts by the prohibitionists, by the opposite, those opposed to this bill, to try and create a stereotype of those who would benefit from this as somehow, you know, freaks or hippies or people who are just trying to con the system and get a high. That is not the view I have of my constituents.
We have about a minute left. I'd like to get your take on some other issues from states that have implemented medical marijuana. I was actually in Colorado when they began to implement it, and one issue that came up is I guess the best way to describe it would be dubious diagnosis. It seemed that you could go into certain medical professionals and get a prescription for medical marijuana for anything. How can you make sure that that doesn't happen?
Yeah, and I've heard a lot of these criticisms, a lot of these concerns, and my bill, I believe, is written in a tighter way than really any of the other 23 states that I know of. We've looked at I think, almost all of them. As far as how we've tightened it on the physicians and tried to eliminate that potential scenario, each one of these conditions typically requires treatment by a specialist. I know that I have a neurologist that puts needles in my back and does the procedures and checks on my progress and tests for nerve damage and all those things and knows my case. But she's not just a family doc or a doc in the box. So she's a specialist. So we have matched the conditions, for example, cancer, with the specialist physician, an oncologist. So that really narrows the opportunity and eliminates a lot of the potential for some of these abuses that other people have seen in other states. We have the opportunity, again, to learn from what other states have done before us and to make this really work right. And I think we can deal with that concern. I think we have in the bill.
All right, Senator Manson, thanks so much for being with us, and we will watch and see how this plays out during this upcoming session.
My pleasure. Thank you.
Polls suggest a majority of Utahns support the legalization of medical marijuana, so we hit the streets to find out what you think. That's coming up next. Thanks for staying with us. What do you think? Should medical marijuana be legal in Utah? According to a UtahPolicy.com poll from March, 66% of Utahns support the idea. Here's how it breaks down. 38% strongly favor it and 28% somewhat favor it. On the other side, 20% are strongly opposed, while 11% are somewhat opposed. Even along religious lines, there is strong support, according to this poll. 50% of very active members of the LDS Church favor the idea, and 75% of somewhat active Mormons do. 95% of Catholics and 64% of Protestants favor making medical marijuana legal here in Utah. We hit the streets to ask the question as well. Should medical marijuana be legal in Utah?
I'm from Washington State. I have my medical card, and it helps for me in so many ways. Not only in a way that I can eat right, I can read whenever I need to, okay, without the pain.
I don't agree with it. I would never legalize it. Do you want me to tell you why?
Why is that?
Because I just feel like marijuana's not good for you. Why would you want it to be legalized in America?
Medical, yeah, I think it should. I mean, you got so many people on these opiates, and that's turning into heroin problems for a lot of these people. Like, they take the painkillers, and that's not enough for them. They get cut off from the painkillers. They got nothing else, so they're going to heroin, right? I think the medical marijuana would fix that.
Yeah, I would fully support it as long as it's for true medical issues, not recreation purposes.
Yeah.
Why is that?
Because it's good.
Because a lot of people suffer, and if that helps them, then why not?
I'm perfectly fine whether or not. I don't agree with marijuana being legal in Utah at all, but if it's what the people want, it's what the people want, I guess.
There's a difference between misusing and using it correctly. I have family members that are on medical marijuana, and it has changed their life.
That's a good question. I have to research that more to give you a good answer.
It makes sense, and it keeps the drugs off the street.
There's other medications without the heavy drugs. I mean, marijuana is it's so easy to get hooked on, and I just don't think it's a good idea.
It's inevitable. Eventually it's going to be legal across the country, either way. You know what I mean? That's what I think. So why postpone the future?
And we posted the question on our ABC4 Utah Facebook page. Here's a look at some of the comments. Devin Salza says it should be legalized across the board. The whole idea we should restrict liberty because of some flawed religious morality is troubling. Just because something is legal doesn't mean everyone will do it or the world will end. Mary Cheney adds, I have seen the benefits of medical marijuana in patients. My big issue are the doctors who will give a prescription for a hangnail. can be so totally abused. And finally, Todd Enger says the evidence is sound that the plant has significant medical uses. Its illegality poses the only significant danger. You can join in on the conversation as well, happening right now on the ABC4 Utah Facebook page. Log on and let us know what you think. Next, our Inside Utah Politics panel debates the issue. What are the arguments for and against? Stay with us.
You're watching Inside Utah Politics.
Welcome back. Now we are getting into the both sides of this divisive debate with our Inside Utah Politics panel. Paul Merrow is CEO for Leadership Project for America. He's also a former president of Sutherland Institute. And Josh Daniels is a policy analyst for Libertas Institute. Gentlemen, welcome to Inside Utah Politics. Great to have you with us this morning.
Thank you. Thanks for having
Paul,
us.
I'd like to go ahead and start with you. What are your top reasons for opposing medical marijuana in Utah?
Well, I think there are policy reasons to oppose it. I think Senator Madsen's bill is very narrow and self-serving the way that it's drafted. I think it is inconsistent with his libertarian principles of limited government. I think the underlying philosophy that somehow smoking pot or using THC-related products is the equivalent of freedom, I think is delusional.
Why is that?
Well, it's because when your mind is impaired, you're not free. It's just a fact. And you're not free to make fully rational choices. And, you know, I'm probably the only one on set who's ever smoked pot. And you know, and I did as a young man, so it's not like I don't know. I'm not just this old dude who's just objecting. I know exactly what this drug is and the culture and everything to go along with it. But ultimately, you know, there's no freedom principle at stake here.
Josh, that's one of your biggest points, though, is that this is a freedom issue. So explain your perspective on that.
Well, you know, I think that when you look at cannabis products as a medicine and you say, wait a minute, we've banned the entire plant and its uses as a medicine, there's no freedom for patients and doctors to explore this as a remedy for a number of illnesses. And so for us, we're trying to look for a policy that strikes a balance that says, look, let's allow patients and doctors to collaborate about the use of cannabis to treat specific illnesses. And when those doctors, a specific list of specialists that treat specific diseases, come to that conclusion, they should be allowed to do that. And government shouldn't tell them what they can or can't explore as a remedy.
Talk more about that, Paul, because we've seen a lot of people come out, people who may surprise you that are using medical cannabis. Why should an adult who otherwise is a law-abiding citizen with their physician not be able to make that choice?
Well, I think there's common ground if we're talking about its use with terminal illnesses or devastating diseases, maybe not terminal, but devastating in the sense that the person's not able to be productive and they're just sitting in pain constantly. I think that's actually what most people in these surveys are responding to when asked about medical marijuana. I think they're just thinking, oh yeah, these folks who have these terminal problems. Senator Madsen's bill just expands the definition for the customer, the patient, however you want to describe the user, to include chronic pain. You know, I have chronic back pain just like Senator Madsen. I've made different choices. There are legal alternatives right now for all of this. So if we're just talking about really seriously terminally ill or people with devastating diseases, I don't think anybody has a problem with that. It's this kind of a delusion of the user demographic that starts to create the problem.
Talk about that, Josh. Is there room for common ground? Maybe not fully Senator Madsen's bill, but somewhere in the middle?
Yeah, and I think Senator Madsen's bill really does accomplish it. There's been some criticism about the idea, well, you know, using it for pain, well, that seems very broad. But there's actually a really good reason behind that. And chronic pain, and specifically the language of the bill is going to be tailored to chronic pain, is important. Utah is 5th in the nation for opiate overdose deaths. We use prescription opiates to treat chronic pain. And there's a lot of risk using those. Many people have had problems where they've accidentally overdosed and gotten very ill and sick and near death, and then you have many who die. In states that legalize medical cannabis, they've seen reductions in prescription opiate overdose deaths as much as 25%. So it's really important that we look at the group of people who suffer from chronic pain who are at a specific risk of opiate overdose. So anybody that could be eligible for a prescription of significant opiate prescriptions should be able to have as an alternative medical cannabis. So I think that's the target audience.
Let's talk about the gateway issue here. A lot of people argue this is a gateway to legalizing recreational use. Do you see it that way?
Well, that is the way it is. I mean, that's the way it's played out in the states where it is legal right now. Again, because there is common ground on true medical needs, that's not the issue, and that's not the politics. The politics really is kind of this libertarian-driven idea that somehow getting high is a First Amendment right or a freedom principle. That's what's driving it. And so initially, you know, it's the camel's nose in the tent, and you get the medical legalization, and then all of a sudden everybody's like, well, what's the big deal? And then it's just everywhere, and it's completely legal.
One of the interesting things that we're seeing in Utah, and that I didn't see, I mentioned a little earlier in the show that I was in Colorado when we saw this transition. There was more of a right-left issue. Here, though, there's a lot of conservative support. Talk about that.
Yeah, I think it's a bipartisan issue. People who recognize that the way marijuana has been treated as a Schedule I controlled substance under federal law has been a complete failure of federal policy in D.C. And there's been a lot of politics behind, you know, the genesis of prohibition of marijuana, absolute prohibition, such that medical research has been hampered as a result. When people recognize this really is a failure of federal policy, they begin to understand that it becomes a states' rights issue, that states ought to have the freedom to control these substances in the state and not be hampered by federal policy. I think that's what you're seeing around the country with the 23 states and D.C. that have allowed for medical marijuana use in their state, and another dozen that have looked at CBD as also a cannabis product, Utah included.
That's one of the ironic things about this, and it's interesting to see how it's playing out. Of course, the Obama administration has said they're not going to prosecute those issues, but it is still against federal law. Is there an issue there?
Yeah, it's a huge issue. Senator Madsen, if he is purchasing product in Colorado and using it in Utah as a sitting state senator, he's actually violating federal law. And the only reason he gets a break in this is because the Obama administration is looking the other way. But, you know, I think I might buy into the states' rights issue if it weren't for so many other reasons not to, including that I'd be interested if Senator Madsen would be willing to follow the lead of public health officials and the medical community in Utah on this issue. They oppose his bill. And they will do so vocally in this next session.
We just have a few seconds left. How will it play out in the session? One vote shy in the Senate. Do you see it passing the Senate this time around?
I think it's got a very good chance. The bill's even better, and there's a better system in place under this bill. I think it's got a good chance.
Paul?
No, I don't think so, because now there's an alternative bill that will be introduced, and that'll get the majority of the votes.
It's kind of more that common ground area you're talking about.
Well, both of them are unnecessary, I think, but yes, I think senators are going to go, oh well, let's go with the lesser one.
All right, gentlemen, thank you so much for being with us. We appreciate it.
Thank you.
Stay with us. We'll be right back.
If you're looking for a truly unique shopping experience, a visit to our new Madison McCord Interior showroom is a must. It's unlike anything you've ever seen in Utah. We still have the largest selection of accent pillows. Why not have us build your dream sofa or sectional when you get it in only 3 to 4 weeks? Our new gallery level features unique oversized art pieces priced from $400 to $1,200. Now through the end of the year, save 40 to 60% off our floor samples.
Why do we gather around the dinner table for life's important moments? It's the place where families come together, where stories are told and memories are made that last a lifetime. Dinner isn't just where food happens, it's where family happens. Research shows teens who regularly eat as a family are 33% less likely to use alcohol or illicit drugs. For more information, visit parentsempowered.org.
This is a special announcement for anyone in America currently faced with overwhelming financial pressures due to back taxes owed to the IRS or the state.
If you owe $10,000 or more to the IRS or other state agencies, tax resolution programs are now available that may help you deal with these problems and get your life back on track.
Time is not on your side. Take the first step toward resolution of these problems today by calling the Tax Relief Helpline now.
Here at Inside Utah Politics, we want to hear from you. What issues do you care about? You can email me at InsideUtahPolitics@goodforutah.com and catch all my updates on Twitter at ABC4Glenn and Facebook, just search Glenn Mills. Thank you so much for making us a part of your Sunday morning. We hope to see you right back here next Sunday at 8 a.m. Have a great day.